Steve, can you talk us through this case study of Ruby to help us understand eligibility in real terms?
Sure. We have a couple of case studies, one to illustrate a case where a person is deemed eligible for SDCP, another where there were doubts about the eligibility. But Ruby is the first one. I should emphasise, of course, Colm, that these are all de-identified case studies, and that's not Ruby's real picture up on the screen, but we're calling this lady Ruby, who's an 80-year-old lady who's lived in residential care for 2 years within the same home. She did go into care with a confirmed diagnosis of dementia, so we know that that criteria is met. We know from the referrer that there were no significant psychiatric comorbidities or other alternative explanations apart from the dementia to explain her behaviours. Ruby's had many incidents over the 2 years that she's been in care, unprovoked incidents of striking staff and other residents, screaming at staff, a variety of other dementia-related behaviours such as hoarding, fecal smearing as well was a problem behaviour. Throughout the 2-year period of her residence in this facility, there's been a number of specialist referrals made, including one episode with the Severe Behaviour Response Team and an inpatient admission in a public aged psychiatry unit. Despite all of the interventions that were recommended by these multiple specialist services having been faithfully implemented by the referring facility, the behaviours have continued. So if we look at the next slide, it sort of speaks to the eligibility criteria in Ruby's case. Certainly in her case, the behaviours are primarily due to dementia because there's no other confirmed diagnosis, and she had had a confirmed diagnosis of dementia made before moving into care. Certainly those behaviours the facility described lie along the severe to very severe end of the spectrum. She has been managed, but with some difficulty in a generic environment for 2 years, and despite significant specialist input, the behaviours have been refractory to reasonable efforts at management. And I guess we had a question from a rural person before. What's a reasonable degree of management in one setting, like in Metro Perth, may be quite different. It may look quite different in regional or rural WA or any of the other states and territories. So it's what's reasonable for that person in that facility at that time in that part of Australia. So Ruby meets the criteria. She's got a dementia diagnosis, severe to very severe behaviours, and a number of experts have tried and failed to get on top of her problems. So Ruby's case would be eligible for an SDCP placement.
And you touched there on the fact that you, referring back to the criteria, that you clearly looked at whether or not SBRT type support would actually address the issues or whether you needed this specialist. So it's just you went through the process there, and you're emphasising that we will look at all steps of support that people might need in their own context before we necessarily go to recommending SDCP. Is that correct?
Certainly, and in the case I've just mentioned, you know, if there's somebody in a rural or remote region that's very poorly resourced and all of the other criteria are met, it doesn't necessarily follow that that person in a remote or regional area needs an SDCP place. They may just need a mainstream nursing home in a metropolitan centre. The dislocation, the removal from country and disconnection from family and community, of course, remains much the same, but it still is an intervention that stops short of the scarce and valuable SDCP resource. So we would look at all of those other alternatives short of SDCP. In the case of Ruby, obviously SBRT has been previously involved, but despite their involvement and despite the home having cooperated with the recommendations that were put in place, the behaviours continued to be refractory. So she's met that refractory criterion here.
So clearly, Anne, it's important to see these programmes as joined up in the offering supported by the Commonwealth Department of Health. Absolutely. So this is essentially the third tier of programme support for people with dementia. Steve, so we've laid out that clearly in this situation there were all yeses then in the criteria that you've helped us understand today.